All right. Hello, everyone. Thanks for joining us via Zoom or by Facebook Live. I'm Deanna Phelan, president of the NBEA, and happy to have joining us this evening is Dr. Martha Mellish, practicing veterinarian and also assistant professor at the Atlantic Veterinary College. Welcome, Martha. The topic chosen for this evening will be ulcers, something that most horse owners will or have had some experience with. And as we're all kind of ramping up for this summer, traveling to clinics or horse shows, or maybe just even recreational riding, I think that we should be reminded what some of the symptoms and obviously treatments if our horses may be prone to or could be experiencing ulcers. So happy to have you, Martha, and looking forward to getting some information from you. So take it away.
Okay, thanks, Deanna. Happy to be here tonight and love to have any questions. I think Nancy is going to organize them through the chat and also through Facebook as well. So I'll be happy to answer those at the end of the presentation. Really interested in what everyone out there is wondering about, right? What I'm not going to address in the presentation here. So I guess if we want to start the slides, Nancy, then we can get rolling. So we're going to talk tonight about equine gastric ulcer syndrome. And it's, there's a couple different components to it. There's many different signs. We're learning more and more as horses get treated for ulcers, what we didn't think there was too much wrong with them. Then you treat them for ulcers and see a pretty significant difference in their behavior or their performance after they've been treated. So we're learning a lot about what different symptoms for gastric ulcers are. And then in terms of the different treatments that are out there, it's mostly basic, good husbandry that's going to, help most horses with ulcers. But there's a couple extra things that we can do for those that don't do well with just, good basic access to plentiful forage and turnout and that kind of thing. So I just want to introduce myself a little bit more. If I can have the next slide, please, Nancy. So I am a 2005 graduate from the Atlantic Veterinary College. I'm from Prince Edward Island. And after my graduation 16 years ago, can't believe it's been that long, geez, I practiced in the Eastern United States and also spent a little bit of time in Western Australia, and then returned to Prince Edward Island as an assistant professor, as Deanna mentioned, in 2017. So I've been back in Atlantic Canada for 4 years now and very happy to be back and to be riding. So I'm a dressage rider. This is me riding out in the snow this winter, hardy Canadian dressage rider compared to when I was in Virginia where I practiced. We barely got any snow at all. So it was a nice place to ride down there, but you just make the most of it when it snows, right? And then my husband's from Nova Scotia and he's not pictured here, but our two children are pictured here. Keith is the boy on the right there. And then my daughter, Josephine. So we're really happy to be back in Atlantic Canada and riding. My father is a warm blood breeder. So quite active in his warm blood breeding operation here on PEI. So that's a little bit about me. I'm all about the horses, both professionally and as a hobby as well. So, okay, Nancy, let's get down to what we're here to talk about tonight. So equine gastric ulcer syndrome, there are two types of gastric ulcers that have been recognized. And what they have to do with are the two parts of the horse's stomach, right? So there's the upper part of the stomach. So Nancy, did you have a pointer, Nancy, or is that you pointing there?
Sorry.
Oh, I wonder how I could, I probably can't do that, Because you're kind of in control of the screen there. That's okay.
I am.
That's okay. Yep, that's fine. So the upper part of the screen, that lighter part that we're looking at, and we're looking at the inside. There we go, Nancy. We're looking at the inside of a horse's stomach. Okay. So we have the esophagus is coming in on the upper part on the right here, and coming into this lighter pink part of the stomach. Yeah, there we go. That's where the esophagus enters. So where food enters the stomach, and then it travels down and sits in the bottom part of the stomach, that darker pink color. And that is where most of the gastric acid is produced in the stomach, and where food begins its digestion before it travels out the lower part of the stomach, or the pylorus, and that's where it enters the small intestine. Yeah, exactly. So there's two very distinct areas in the stomach. This upper part is where we most commonly see ulcers, and it's called a squamous part of the stomach. So it's like, if you want to think of it a little bit like the palm of your hand or the heel of your foot, it's kind of a thick, tough in some ways, texture. And it is, like I say, that's the area where most of the time we're going to be seeing gastric ulcers, or where we're going to be treating gastric ulcers. And we understand an awful lot more how the disease works in this part of the stomach. The lower part of the stomach is, like I say, where we produce stomach acid. And that part can also have stomach ulcers, but it's a less well understood area. It's more difficult to diagnose as well, because we'll talk about how we diagnose gastric ulcers. It's mostly with basically looking on the inside of the stomach, and it's harder to visualize that part of the stomach as well. But it certainly can cause discomfort or poor appetite in horses as well. So most of what we're going to talk about tonight is equine squamous gastric disease, and disease in that upper part of the stomach. So why is this area more commonly affected, this upper part? So we'll have the next slide, please, Nancy. And what this is a drawing of just basic stomach anatomy. So this is the same picture that we were looking at before, right? So it's the same outline of the stomach that we were looking at before, just with the drawing rather than the dissected version of it. And on the left, the area where it says non-glandular, no acid, no protective lining, that's the area where we're talking about squamous ulcer disease, and the disease that affects most performance horses. Then in the bottom, you have an area that's producing the glandular stomach that's producing acid and as a protective lining. So when you think of a horse that's exercising, so really working hard, it's contracting its abdomen, so you'll see that line of its abdominal muscles really tightened. You think of us doing plank or doing sit-ups, right? You have a contracted abdomen. We need our core to exercise, and the horses are the same way. Even though they're on 4 legs versus 2 legs, they're really engaging their core. We're asking them to engage their core, engage their back, and what that does is it puts pressure on their stomach. Right. So just like if we've had a big full meal and then we go like ride our horse or go for a run, it's no fun, right? Because your stomach is really full and it's uncomfortable because you're putting pressure on it. So it's the same thing when horses are being really athletic. So whether it's a racehorse in training, a horse you're asking to jump, or even if you're asking it to do, a longer trail ride or a longer session in the ring, you're putting more pressure on its stomach. So the acid that's being produced in the bottom part of that stomach is splashing up on the top part of the stomach due to abdominal contractions. So if you have an empty stomach, so a horse that hasn't had any food in its stomach for quite a while, then it's going to be much easier for that acid to splash up on the top part of the stomach. Now, I made a reference before about, so you or I had a big meal and went out and exercised would be uncomfortable. Horses, you wouldn't want to feed them like a huge grain meal right before you go out and exercise them, but having them a little bit of forage in their stomach does help protect that top part of the stomach with increased abdominal contraction. So just a little, like I say, a little forage meal can really help make an extra protective layer for that top part of the stomach. Coming back to what is important that's in the stomach in terms of, how the horses feel. If you feed them a high starch meal, they're going to make what's called volatile fatty acids. So those are compounds that are made from corn, really kind of not fat, but starch grains, what we would typically think would be in a sweet feed. That's going to make another type of acid that again can be damaging to that upper part of the stomach. So those are a couple causes of stomach ulcers. Okay. So just athletic training, just like endurance horses that go longer distances have a higher rate of gastric ulcers, as do racehorses that are really athletic. because they've had that abdominal contraction and there's more contact with the stomach acid on the top part of their stomach. So those are the risk factors: is they're working quite hard, if they're on a high starch grain, and also if they're using pain medications such as phenylbutazone or Banamine, that can reduce some of the protective factors in the stomach as well. Okay, let's go on to the next slide, please. So which horses have gastric ulcers? So I talked about a little bit in the last slide, but thoroughbred racehorses, so ones that are in kind of an intense athletic conditioning program, the great majority of those will have ulcers. Standardbred racehorses, and this is a picture of Roll With It Harry. He is a standardbred racehorse that is also a breeding stallion. So we're getting ready to work with him this spring as a breeding stallion, and he was also a racehorse. Well, he has been a racehorse throughout his younger years, but this is him last year at 11. He was still racing and doing quite well in a decent time there, 1:56 and 2. But just look at his abdominal contraction there, and if you gastroscope a horse right after it's run a race, its stomach is very small. Like their stomachs really contract. So there's just an awful lot of contact, like I say, with that stomach acid and the inside of their, that upper part of their stomach. So show horses, sport horses, certainly there are, if you went and scoped 100 of them, it would depend on some other factors such as the individual trainer. That can be a factor, whether a lot of horses in their barn have stomach ulcers or not. That's been studied and seen. So if you have a more stressy trainer, then you'll be closer towards the 58% of show or sport horses can have stomach ulcers. Pleasure horses are in that same range. Endurance horses, like I was saying, especially the elite, 100-mile endurance horses can have quite a high rate of stomach ulcers. And then horses that are rarely competed and used at home, just as you would expect, in a low stress environment, they have the lowest rate of stomach ulcers. Now, a couple other factors that have been shown to increase gastric ulcer risks are lack of direct contact with other horses. So a horse that's kept totally by itself, or maybe it's not kept by itself, but there's a solid barrier between it and the horse that's beside it. So it's much better if you have rails so that the horses can see each other. They're herd animals. It makes them calmer and happier to be able to see other horses. Another one was talk radio rather than music. So I guess horses like to listen to music. They didn't say which kind of music in the study, but they do prefer music over talk radio. Some management schemes in other parts of the world will actually just feed straight straw. So I doubt there'd be too many places in New Brunswick where there'd be straw feeding, but that is a big one that can cause stomach ulcers if you just feed straight straw. Like it'd be straw and grain, or horses that are really easy keepers. And then another one is lack of access to water in a paddock. So if horses are just given water once or twice a day, then that's a higher rate of stomach ulcers as well. So, okay, well, let's move on and talk a little bit more about individual risk factors. So coming back to what the horses are actually eating, a high grain or starch diet, you're making more acid in their stomach as a result of these feeds. So especially if you're feeding quite a bit of it, so greater than 6 kilograms or 12 pounds of grain, there's more likely to have a horse with a stomach ulcer. Like I say, no contact with other horses, just intermittent access to water. And then if the horses can't be turned out or they don't have constant access to forage or fed forage, just a couple times a day or, and they clean up their hay really quickly, then they're more likely to have stomach ulcers. So what are signs of these, of this condition? So the classic signs that have been accepted, no matter what, no matter who you talk to, which veterinarian in which country or which publications that they read or which horse owners that you talk to, like the real classic signs are a horse that's skinny. They have a reduced appetite, especially for grain, or they're picky eaters. You feel like you have to put a buffet in front of them. Like, oh, what are they going to eat today? Do they want to have some soaked beet pulp? Do they want to have pelleted feed? Do they want to have fat and fiber? You're just always trying to entice them to eat. That would be a horse that you'd kind of be thinking, okay, maybe this horse has gastric ulcers. And then horses that have chronic recurrent colic that you can't really find a reason for. Like, geez, you know, there hasn't been any change in their diet. It's not like you just dewormed them recently, you know, no social stress that you can discover with them. And they just keep, you know, having recurrent colic. Those are real classic signs of stomach ulcers. So that should really be thinking of ulcers if you see these signs. Now, some other signs of ulcers that aren't quite as, you know, traditional, if we look on the next slide, Nancy, are, you know, if you just have a nervous horse, maybe they have stomach ulcers, and that's part of their, you know, why they're so nervous all the time. It could be, you know, chicken and the egg. Are they nervous and that's why they have ulcers, or do they have ulcers and that's what's making them be more fractious, or, you know, bucking when they shouldn't be, or, you know, really anxious when there's really no need for that. Cribbing and gastric ulcers have been linked. So there have been horses that, you know, you treat them for stomach ulcers, and then that helps with their cribbing. So that's something that we've been discovering. It's been shown pretty consistently that if a horse is girthy, then that may be due to pain in that area, because their stomach is right underneath where you tighten the girth. It can also be behavioral. There's no question about that. There's a lot of horses that have perfectly lovely linings to their stomach, but they're still girthy. And then poor performance. And that's, you know, can be seen on many levels. And, you know, if you ever say you're training a thoroughbred racehorse, and, you know, it has stomach ulcers, it can really improve its oxygenation and its exercise capabilities, you know, if they're treated for stomach ulcers versus not. So how do we diagnose this condition? So we'll look at the next slide. So this is another view of the stomach. So on that first slide, we were looking at a stomach that had been totally opened up and dissected. But to look at a live horse's stomach, what we do is take a flexible camera, so an endoscope, or in this situation, a gastroscope, because we're using it to look at the inside of their stomach. And it's pretty long. It's 3 meters long. If anyone's seen a gastroscope done on their horse or horse in their barn, like, it's pretty amazing how long of a camera you need to get down into the horse's stomach. You have to go up through their nasal passageway, all the way down their esophagus, all the way down in their stomach. And then to be able to see the outflow tract of their stomach, that pyloric area and the glandular part of the stomach, we have to go, you know, all kind of coil around and traverse down into the bottom part of their stomach. You do need that full 3 meters. And you also have to ask the owners to hold the horse off any feed for 18 or 24 hours. This is more important in warm blood or sport horses versus race horses. You might not need to have them fasted for quite as long, because, like I say, with, you know, really intense exercise, their stomachs will shrink up pretty well for you. So especially if you scope them after a race, they might not need to be fasted for that long. But most of the horses that we're looking at that aren't race horses do need a good 18 hours to be fasted. And with that, we don't want them on straw, because they'll eat the straw, right? They're pretty hungry by the time they get to 12 hours. I know I'm pretty hungry if I don't eat for 12 hours. So we have the same sentiment with the horses. And then we'll also pull their water. Say we're going to scope them at 10 o'clock in the morning. We'll try to have their water pulled at maybe 6 a.m. so that you don't have water sitting in their stomach, because you just can't see if they have feed and water sitting in there. So it does require some preparation to do this exam. Now, the picture that we're looking at here on the left, the lighter colored, tissue, that is the squamous part of the stomach. So that's where we're looking for ulcers caused by stomach acid that's splashed on the top of the stomach. And then where it transitions into the darker pink, that line, that whole line, that's called the Margo plicatus. And that is a term that veterinarians learn in their first year of vet school. And that's a pretty common place for stomach ulcers to be. And that's a good landmark. It tells you, you know, in the lighter tissue above that, we're talking about glandular, below that, or sorry, non-glandular, below that, we're talking about the glandular aspect of the stomach. So that gives us kind of a landmark to look out there. So this is a nice, healthy horse's stomach. It's a beautiful, light colored lining. On the left side, looks nice and shiny. That means there's a good mucus layer there protecting the inside of the stomach. So let's look at the next slide. We have a couple pictures of horses that actually do have some erosions in their stomach. And so on the left, grade 0, that's again what we want a horse's stomach to look like. Okay, so we have the division between the top and the bottom part of the stomach. That green is just a little bit of food that's stuck on the walls. We can actually, when we're doing the gastroscope exam, we can actually squirt some water in there, clean off any extra food that's sitting on the inside of the stomach, and make sure there's no ulcers hiding underneath it or anything like that. So if you have a horse that actually does have stomach ulcers, depending on the number of them and the size of them will give them different grades, right? So grade 1 are just kind of little pinpoint ulcers. Once you get to grade 2, the ulcers are larger. And then instead of just having kind of solitary patches of red, of erosions into that mucosa, or, areas where it's into the more sensitive tissue underneath it, there'll be several of those areas that'll be kind of grouped together. So that just means there's larger area of the stomach that are damaged. And then once you get into grade 3, they'll actually be bleeding. So the horses will be, it'll be eroded to the point where you actually have blood loss. Now, it's important to note that the severity of ulcers aren't that correlated with the severity of symptoms. So you could have a horse with grade 3 ulcers that is, fat, shiny, eats pretty well, but maybe he's just girthy or, just isn't performing the way that you would like them to be. And then you could have a grade 1 horse that is just won't eat any grain, won't keep any weight on, and it's not correlated with the severity of the symptoms. So that's why it really is, if it's possible at all, it's really good to do a gastroscope to diagnose the severity of ulcers, if there are any there. And then that'll just really let you know, if you treat the horse, okay, number 1, did they have ulcers to start off with? And then say you treat them, and then you can check them at the end of it and make sure that you've resolved the problem. Because, your horse, right? Like some of them will they'll be, have a terrible, a hoof abscess and they're barely limping from it. And then other ones get like a hangnail and they can't even do anything. They're just, so painful and so like dramatic, right? So it's the same thing for stomach ulcers. It just depends on the horse's temperament and their kind of constitution, whether they really, show the similar severity to what you see on gastroscope to what the clinical signs actually are. So any horse with kind of vague signs of abdominal discomfort, it's never a bad idea to do a gastroscope and have a look at them. And, like I say, some of those horses that look pretty good from the outside, and maybe you can't scope them for whatever reason, you can't do a gastroscope on them, but then you treat them, or maybe you do scope them, but you treat them and you see a really significant change in their behavior. That can tell you, gosh, maybe they were just kind of covering up that they did have some abdominal discomfort. So it can be pretty cool how much they can cope with, really. But then it's nice when you can help them out for sure. Okay. So the next slide there, Nancy, is just kind of a gee whiz thing. When we do gastroscope, sometimes we'll see bots. So those are parasites, those little yellow eggs that come in the fall. The bot flies lay their eggs on the horse's legs, and then it migrates through the horse's lips and sub-Q tissue all the way down to their stomach. And then they sit in the stomach. So this is a picture of the non-glandular part of the stomach. And then those like pink bubbles on the left there, those are actual worms that are sitting inside the horse's stomach, bot worms. Yeah. So that can be just kind of a gee whiz factor when you're doing a gastroscope, and those are treatable with ivermectin. They're not a cause of gastric ulcers, but it's good to know if the horse does have bots, and then we'll treat them. So hopefully your horse doesn't have that, but if they do, you can see them on a gastroscope. All right. Now, in terms of treatment, the 3 main things that you're going to look at are environment. How can you modify where this horse lives or how he lives so that he's a lower stress level and will be less likely to have gastric ulcers? We're going to look at the diet, and then to kind of put a a Band-Aid on an immediate problem, a horse with severe ulcers, then you'll treat them with medications or dietary supplements. So let's look at each one of those individually. So if we look at the environment, as I was saying before, pasture turnout, if they don't have any access to pasture, then that is a risk factor for stomach ulcers. It can be variable. Some horses do totally fine without being on pasture, but some horses need to be on pasture. I would say most horses do benefit from it in terms of their stomach health. Contact with other horses. Now, you do want to make sure that these aren't horses that are at the bottom of the totem pole and they're getting picked on by other horses, because I have seen that happen in several scenarios actually, where like you're wondering, like, gosh, this horse it's turned out with other horses. It has a pretty low stress life. Why does it have stomach ulcers? And then, kind of digging a little bit deeper, you realize, oh, this horse is at the bottom of the totem pole. It's getting picked on. It has quite a bit of social stress by other horses out there. So you have to look at it on a horse by horse basis. Maybe this horse needs a new turnout group. Maybe it needs individual turnout where it can see other horses. If you're trying to treat it for stomach ulcers. Now for elite athletes, so those horses that are, race horses that are in training, endurance horses that are doing longer distance, dressage horses that are doing really upper level stuff, maybe you need to reduce the exercise just to, somewhat decrease the stress in their life, and then also decrease that physical contact with stomach acid in the top part of their stomach if you can't control it through diet and medication. So that's just another thing that you can look at. And something that when I worked in Virginia, we had the company that sold GastroGuard would come around and do gastroscopes for free. So if you wanted to have your horse gastroscoped, then you could come to the clinic, and the company that's sold GastroGuard would come and scope your horse. And the salesman was kind of an interesting guy. He would say, we don't want to see any horses that are on pasture. We just don't want to see those horses here. And the reason why he didn't want to see them is because they're not going to have stomach ulcers. So that was his take on it, was just don't bother bringing those ones that are turned out on pasture. We're not going to see anything. So if that's kind of straight from the salesman, those horses won't have stomach ulcers likely. Now, if you can't put them out on pasture, just continuous access to hay, or hay that's fed more than twice a day. So fed 4 to 6 times a day is something that can really help with stomach ulcers as well. Okay, so we'll move on to diet. And like I say, kind of the, both diet and environment are linked, obviously, right? So whether you're on high quality pasture, fed hay 4 to 6 times a day, or free choice. And then you really do want to try to decrease the amount of grain that they can be on. Less than 1 kilogram per meal is ideal. If they do need some grain to keep their weight on, at least allow 6 hours between grain meals as well. And as low as starch of grain as well. There's a lot of different products out there that are stomach friendly concentrates. So if the horse does need to be on grain, then they can be on a higher fat grain, or even adding an oil to their feed. That can really help as well. And that can help with glandular stomach disease too, adding oil to their feed. So that's another option. So, okay. And then the next slide there. So, say I gastroscope a horse and it has stomach ulcers, and, we want to treat them. The medication that I would recommend would be omeprazole. And typically I would use it in the form of GastroGuard. So that's the once a day paste that is buffered against stomach acid, because a horse's stomach, the acid level goes down quite low. Like, it's pretty incredible. It'll go down to a pH of 1, which is a really, really acidic pH. Then it'll, bump back up maybe to 6 or 7, and then it'll flush back down to 1. So that's the hard thing about treating with compounded omeprazole, is that its delivery of the medication can be more variable than GastroGuard. GastroGuard itself can be variable in terms of its delivery. It's just hard to deliver this medication to the horse's stomach due to the different acidities that are present there. So that's the kind of the mainstay of treatment, is to treat them with GastroGuard, a 4 milligram per kilogram dose for 28 days. And then you check them at the end of treatment and see if you have resolve the condition or not. Now, horses can also be put on a lower dose of omeprazole or a lower dose of GastroGuard if they don't have stomach ulcers, but you're trying to prevent them. So that's another kind of scenario where they don't have to be on it for a full 28 days. Every time you start GastroGuard, you don't need to be on it for 28 days. It can just be for a few days while they're in a stressful situation. But the mainstay for treating is to treat them for at least 28 days. Because what you're doing is reducing the level of acidity that's in their stomach. So the pH shouldn't be going down quite as low and causing as much acidity, and then allowing the lining of the stomach to heal because it's not being damaged by stomach acid. So it's a proton pump inhibitor. And that's how a horse's stomach produces acid, is through those proton pumps. So that's the main medication to use. Okay. And let's go down to the last slide here. So just in prevention, just because I was kind of saying at the beginning of the talk, a nice consistent routine and diet. It has to be an appropriate diet, so low concentrate, as high a forage as possible diet. So you do need a high quality forage, which this year it's been a hard year for finding hay and appropriate high quality forage. So if you do have to supplement with concentrate to keep your horse's weight on, you do want to have concentrates that can be friendly to their stomach if you have a horse that's prone to ulcers. If you are going into a stressful situation, so you're going to a show, maybe you're changing barns, kind of any change in the environment you think might bother the horse, it's never a bad idea to put them on a low dose of omeprazole. And then there are so many different supplements that are out there. Not too many of them have been shown to heal stomach ulcers, but they can make it if they have a really strong buffer. So if they can really kind of decrease the acidity of the horse's stomach, at least for a couple hours around the time when the horse is eating grain, then it can help them finish their grain and get the energy and the nutrients from the grain. So that can be really helpful. And they can also, certainly kind of help not make those fluctuations in acidity quite as dramatic as well. So there are a lot of good supplements that are out there to help horses as well. So certainly be happy to entertain any questions and answer them best that I can anyway.
Okay, excuse me, we'll bring up the chat function, and anyone on the Zoom call who has a question for Dr. Mellish, you can type your question into the chat, or you can just indicate there that you have a question and I can call on you then. First question, what would you use to treat hindgut ulcers?
So that's not in the stomach at all, right? That's in the colon. So that's further down in the digestive tract. And, some veterinarians will treat hindgut ulcers with omeprazole. I don't think that's the wrong thing to do, but there are some other medications that can work a little bit better. So one of them is sucralfate. So that's a medication that acts like a Band-Aid on the inside of the colon. So it mixes, once it hits water, the horse's saliva, it kind of sticks to any type of damage or injured mucosa. So sucralfate can really help with that. Another medication, which is a little pricey, is it's called misoprostol. So that's something that helps. It's a medication that can help heal the colon as well. And then a lot of times we'll put them on a low bulk feed, so Equine Senior, which has, enough energy for the horses, but it's quite a low fiber content, and just kind of give the colon a rest for a while is another thing that you can do. So it would depend on the individual horse, whether you need to go, all the way with all the different medications that I mentioned, or if you're able to change feeds and have kind of a hindgut conditioner, that can help as well with a horse that doesn't have like full blown hindgut ulcers, but just needs a little bit of help with digestion.
How are hindgut ulcers different in terms of symptoms and diagnosis?
So you can't do a gastroscope for a hindgut ulcer because, it takes us 3 meters to get to the horse's stomach, so we can't get all the way back to the colon with a gastroscope. So that's something that's more measured by the horse's protein levels. So if they have a lower protein level, be more worried about hindgut ulcers, or by ultrasound. So we do an external ultrasound and look at the horse's colon and see if it's thicker than it should be. Then we're concerned about having hindgut ulcers. So it's a totally different process to diagnose hindgut ulcers than it is to diagnose stomach ulcers.
How much fat do you recommend adding to the feed?
If you're going to be adding fat with an oil, I would typically only go up to a cup of oil a day, and you want to work your way gradually up to that cup, so you start out with a quarter cup, do that for a few days, go up to half a cup, and you'd only want to have to do half a cup for feeding. You'd want to divide it up into at least 2 feedings because they can get diarrhea from it. So if you just start off low and then just gradually increase it, that's about the amount that I would recommend, would be about a cup of oil per day.
Nina is asking, how does Comfort Gut work? I take it that's a product.
Yeah, I am not familiar with that one. So sorry, Mia, I'm not very helpful with that one. I'll have to look that one up.
Brianna says, I'm currently treating with sucralfate, misoprostol, and GG for ulcers with hindgut. Which preventatives are currently recommended, and do any come with any guarantee?
The main product that comes with a guarantee, and I don't know if it's still on right now. I know it was on in 2020. I need to check that for 2021, is GastroGuard for stomach ulcers. If you treat a horse for 28 days and then you get it gastroscoped at the end of the treatment period, and the horse still has stomach ulcers, the guarantee that the company will offer is that they'll send you another treatment of GastroGuard. So that's the main guarantee that's out there for medication that I know of. In terms of the preventatives for hindgut ulcers, one that I really like is Succeed as a hindgut ulcer, as a hindgut conditioner. That one is one that's been around for an awful long time. So that's the main one that I recommend, but I don't know of a guarantee that it offers, to be honest with you.
Leah's asking, how much does the risk of ulcers increase with age, or the severity of ulcers with age?
There's not a really strong correlation with older horses getting stomach ulcers versus younger horses. So it's not something that they're more prone to as they get older. It would just be a matter of what their individual environment is like, or their workload. So certainly young horses can get just as bad ulcers as older horses. So I wouldn't say that there's that age is a really big factor, that they're much more likely to get them as they get older. Maybe, as I get older anyways, I like my routine. I don't like getting out of my routine, so that might stress me out a little bit. And I think older horses can be like that too. They just want a really consistent routine, whereas a younger horse might be a little bit more tolerable to that, or a younger horse might not be in as heavy workload as an older horse, but the actual, so that might make them more prone to having a higher risk of ulcers, but just age itself wouldn't make them more prone to it, or it doesn't typically.
Can you speak a little more to the correlation between cribbing and ulcers?
That is something that's been, discovered as we've been doing more gastroscopes, that there's just a higher risk of horses that have show cribbing behavior. A lot of those do have stomach ulcers, and it can help in some horses. Now, I wish it was all horses, but it can help in some horses to have to treat those ulcers, and then the cribbing improves with it. But it's kind of like like a lot of like I was trying to say, the degree of stomach ulcers don't necessarily correlate with the degree of symptoms. So it's, if you have a cribber, I wouldn't just put it on a month of GastroGuard. You'd want to say, like, fast the horse, look at the inside of its stomach, see if it actually has stomach ulcers or not before you would treat it. That would be my recommendation anyways, because some horses just crib and they don't have stomach ulcers, but it has been shown that some horses, it can help them to treat them for stomach ulcers. It can help with their cribbing.
Thank you. Are you familiar with Mad Barn Visceral Supplement? If so, do you have any opinions?
I haven't used that one before. So I'm gonna write a couple. I'm gonna get Nancy to send me the chat here so that I can look up a few of these different supplements. So I'm sorry, I don't have a good opinion about that one.
Roberta wants to know, is there a difference in symptoms with hindgut compared to stomach ulcers?
Hindgut ulcers, like they can be similar in terms of poor performance, right? So horses can be mildly colicky with both of them, kind of a mild recurrent colic with both of them. You're more likely to see diarrhea with hindgut problems, whereas with stomach ulcers, if it's just their stomach, you shouldn't see loose manure from that typically. So that can be one symptom that's a little bit different. And, stomach ulcers are more common than hindgut ulcers. It's more likely to have hindgut ulcers if a horse has been on a course of bute or banamine. That is a risk for stomach ulcers as well. But if a horse has been on bute or banamine for a long period of time, maybe they have, chronic leanness or laminitis, that's when their protein levels can really decrease because they've been on bute or banamine. So they can be fairly similar. There's no really clear indicator one way or the other. The girthiness factor wouldn't be as much with hindgut ulcers as it would with stomach ulcers, but that can be so variable depending on the horse as well.
Our chatters are expressing their gratitude for these great responses. Once a horse has had ulcers, are they more prone to recurrence?
I would say yes, unfortunately. They are, especially if you know that about your horse, that they have had a bout of stomach ulcers before, and you can recognize the behavior that's associated when when they were either diagnosed with stomach ulcers or they responded to treatment, then I would say that they are more prone to it. And it's so funny, like some horses, you can put them on bute or banamine and, it doesn't bother them. It doesn't have negative side effects in terms of their gastrointestinal tract. And some horses are so sensitive to it. So that can be kind of an individual variation there as well. If they are, if you've had to put them on bute or banamine for some reason before, and they developed stomach ulcers from it before, then I'd say they're quite prone to doing that in the future. So just something to keep in mind there.
Would it be better to feed forage right before exercise to help prevent ulcers?
I think that's a good thing to do. It doesn't have to be a lot. It doesn't have to be, half a bale of hay or anything like that. But even just, soaked alfalfa, some short fibers, and alfalfa has been associated with buffering stomach acid as well. So I think that's a good management thing to do, especially if you have a horse that has had stomach ulcers in the past or does have stomach ulcers and you're treating them, but trying to keep them in work as well. So if you can give them like a small meal of forage before you work them, that's a really good practice. And it's also a good practice, not in association with working them, but when you feed, concentrate, the timing of that versus when you feed forage. So it's always better to feed a horse forage first, have that meal, then you feed them the concentrate. If you, there's studies where they try to, look at causing stomach ulcers. And part of that model is to feed them a big concentrate meal, so a lot of grain, but you feed them grain on an empty stomach. And then you feed them hay. So if you want to do the opposite of that, right, you're going to feed them hay first and then feed them grain after that in the morning. That's a nice way to do it if you can, if that's a reasonable thing to do.
Sounds like Pony Club rules.
Yeah.
Hay first and grain.
There's a reason for them.
That's
yeah.
Right.
Yeah.
Do you have any favorite supplements to help manage stomach ulcers once a horse has already been treated with omeprazole and their ulcers have been cleared?
I have my own kind of personal experiences with it. So, but the hard thing is in terms of, is that going to work for any horse? So I think the GastroFX, I think that is a helpful supplement. But I think, as much as you can manage their diet and their environment, those are, really critical factors to it as well.
Right. That's the last question here. Are you familiar with GastroFX? And if so, do you have an opinion on it?
I think it is. Yeah. Yeah, I think it is helpful. You do want to use it at the label dosage, and, try to have all the other factors lined up as well as you can with it.
Right. Gianna, you've been watching our Facebook feed. Have we got questions from those folks?
Yes, we do. Jenny wants to know, are there any specific feeds and or supplements you would recommend? Are high fat and fiber feeds detrimental?
No, so high fat and fiber would be, in my mind, an ulcer friendly feed. So you do need to look at the, on the label, and see what the, what the fat content is. If they list the starch content for you, that's, that's helpful as well. I was messaging with a Purina rep in Canada, because when I practiced in the United States, Purina had a great supplement. It was actually a seaweed supplement. It had calcium in it, and it had really nice big surface area to it, but that's not available in Canada. So that one isn't quite as good. So yeah, I would say typically your fat and fiber feeds are good. If you can just do a straight fat supplement with high quality forage, that's very stomach friendly as well. Platinum Performance is one that's, high fat supplement. It's a flaxseed based one. So that can really add some calories without having, detrimental effects as well.
Okay, and Michelle was wondering, will exercise or getting back into shape spike hindgut ulcers like it would for, I'm not sure what that is. I'm currently treating hindgut and have been for a month now, and I want to ensure I'm not going to do any additional harm.
It's not the same mechanism, I guess. Like, you're not going to have that same acid contact with increased exercise in the hindgut like you would in the stomach. So it's mostly a horse's like stress level and its diet that's going to impact the hindgut ulcer part of it. So as long as you're not stressing the horse too much by working it, which is so individual, I wouldn't think that would spike it up too much. But if you have a horse with a severe case, a lot of the times we will just give them a break for a while if they do need to heal from that. If they're really not keeping their weight or really uncomfortable, then that is the safest way to go. So I don't know if I'm too much help there. That sounds like an individual horse, you'd have to look at all the factors for that one.
And Rochelle was wondering, which I think you've mentioned a couple of times, would horses on bute for lameness issues benefit from an ulcer medication prevention? So a lot of times when we feed bute, or we're probably, for a lameness issue, we're probably doing some omeprazole along with the bute.
Yeah. And I think that is a good practice. Another thing, there is also Previcox, right? So Fercoxib, that's another type of anti-inflammatory that has a much lower risk of ulcers. So that's, if a horses, some respond just as well to Previcox as they do to bute. I would say bute in general is stronger than Previcox. So if you can get away with Previcox, that is a much safer way to go for their GI tract as well. And then, you wouldn't need to add the omeprazole on top of that typically.
We have a couple more questions here. What about Nexium as treatment?
So is Nexium, what is that? Is that a human treatment?
I have a feeling it's omeprazole, but it's the human commercial name for it.
And that's the problem. Yeah, that's the problem with a horse's stomach is that, it'll just burn up anything that's not properly buffered so that the horse can actually absorb it. So yeah, you look at Nexium, you calculate how many milligrams that you might need for a horse, but it's probably not going to really do anything. It's probably just going to get just burned up in their stomach, for lack of a better word. They probably wouldn't be able to have a therapeutic effect, even though it probably would be cheaper than doing a Gastrogard or another omeprazole that's compounded for horses. Yeah.
Roberta wants to know, what are the best fats, canola or any others?
Yeah, there's a lot of discussion about that in terms of the, omega-3 versus omega-6 fats. So some people just hate corn oil, right? Because they consider it pro-inflammatory. And I guess I do agree with that, but I still do think, you know, if you can just if you say you have a really thin horse and it wants to eat corn oil, then, and it helps put weight on them, I think that's really the way to go. You know, if you can get results from it, you know, rice bran oil, that is less inflammatory, but it is kind of expensive, you know? So it just kind of depends on how deep you want to reach into your pockets in terms of the highest quality fat that you can get for your horse.
Right.
Because, you know, if you look at, you know, grass in the horse's hindgut, it does get converted into fatty acids, and it's pretty high in omega-6 there as well. So I think you do need to pay attention to your horse, and if there's an oil that's reasonable for you in terms of how much you can spend and it makes a difference for them, then I think you just have to look at that whole picture. So, you know, if you can do rice bran oil, I mean, flaxseed oil, that's really expensive, you know, but if you can do those things, then that probably is preferable over corn or canola oil. But if your horse does well on those oils and you can get enough into them, I think I think those are fine.
What about camelina oil?
I know there's all the, I've heard a lot about camelina oil, but I haven't used it myself or had a horse that wasn't on it before and then got put on it and made a big difference. So sorry, I can't offer opinion on that.
That looks like all I have here. Deanna, anything else?
Yeah, I have one from my horse is borderline EMS. So a fat would be more detrimental than beneficial. That's the question. He is on fiber nuggets right now. What would you recommend?
Yeah. And for equine metabolic syndrome, we're worried about pushing horses into, you know, a laminitic episode. And that's typically through sugars, right? So through sugars and starch, a high sugar and starch diet. So fat, if they need to have more weight on them, which some EMS horses are quite fat, but some aren't. Some just have kind of patchy fat, you know, they'll have the fat on their crest or, you know, patches of fat above their tail head, you know, but you can still see their ribs. Then having them on a high fat diet is a pretty safe way to go, or adding fat to their diet is a safe way to go. It shouldn't cause them to have, you know, have a founder episode or, you know, or anything like that. So no, if you can get them to eat fat and fiber, you know, the fiber nuggets or, you know, good quality forage that's not too high in carbohydrates or non-structural carbohydrates, then that's the way to go.
This question is asking about aloe vera juice. Any actual medical backing, or is it just a fad?
It's been around for a long time, you know, and you have to use a fair amount of it. I think it's 60 mils, and you want to use it at least a couple times a day. And, you know, I've heard a lot of veterinarians recommend it. You know, you kind of get a big jug of aloe vera juice and use it as part of a supplemental, you know, part of treatment, or I guess prevention for gastric ulcers. So especially if you use it, you know, say you have a horse that has a severe case of ulcers, you have them on omeprazole as well, and you put them on aloe vera. I certainly don't think it does any harm, and it's not really, you know, expensive to use. So I don't think it's, you know, healed a severe case of ulcers, but I don't think it does any harm to supplement with it.
Okay. You have any more in there, Nancy?
No. Looks like
all right, I just have one here that's changing the topic slightly. Does PEI offer blood testing for vitamin E levels?
Yeah, if you can through the provincial veterinarians in New Brunswick, or yeah, we offer it's vitamin E and selenium. Typically, you test them together, okay. Because they do. Oh, you mean on the horse's blood or on the forage? I wonder.
Probably on the horse's blood, I would think.
Yeah. Yeah. No, that's a pretty common thing to check because so many horses are low in vitamin E and selenium. Yeah. And it's a good thing to check.
Perfect. Thank you. Well, it's been a very informative evening, and thanks to our membership for coming out and certainly in being involved in the dialogue. It's great that we can hear from our membership, and Dr. Mellish, you're a wealth of information. I appreciate that. And you break it down so nicely for us to understand. So thank you for your time. And thanks to all of you, those taking your Sunday evening to join us on our chats. And we're looking forward to talking to Dr. McMillan next month on the herpes, since there's a large herpes virus going on in Canada and all over the world with horses. So keeping our membership up to date and informed on a lot of issues that affect us as horse owners. So thanks for those of you that joined us. And Dr. Mellish, thanks for your time this evening.
Oh, you're very welcome.
Thank you. Good night.
Thank you, everybody. Have a good evening.
Good night.